Hello and welcome to this presentation entitled Integrating Harm Reduction Strategies into Hospital Settings for People Who Use Methamphetamine. My name is John Serato and I am the research coordinator for this project. Harm reduction strategies for methamphetamine use are not currently implemented in hospitals in Canada. This is because safe consumption of substances requires an exemption under Section 56.1 of the Controlled Drugs and Substances Act. A recent publication revealed there is a greater risk of infection as an inpatient in hospital than as an outpatient in the community among people who use methamphetamine. We hypothesize this study will potentially improve hospital care for people who use methamphetamine, promote patients' involvement in their care, meet patients' needs and reduce adverse health outcomes such as infections, and reduce health service utilization and health service costs associated with using methamphetamine. This study is aiming to recruit up to 360 adults aged 16 to 85 with past or current lived experience of using methamphetamine and have received service from any type of hospital. We're also looking to enroll up to 180 healthcare service providers who have direct contact with people who use methamphetamine. As you can see, this is a 4-year project. In year 1, we'll look to acquire suggestions and recommendations for harm reduction strategies. In year 2, we'll be developing and implementing these strategies. And years 3 and 4, we will be evaluating these strategies. Participants with lived experience will complete individual interviews which consist of quantitative and qualitative items. The qualitative items will be audio recorded for analysis. Healthcare and service providers participated in qualitative interview discussions, meaning one-to-one virtually, or virtual focus groups. As you can see from our demographics, the mean age was 35, 72 identified as male, 37 identified as female, and 3 identified as non-binary. As well, 10 participants identified as being a member of the LGBTQ2+ community. The majority of our sample was Caucasian. Our Year 1 findings revealed that 85 participants had current use of methamphetamine. Tobacco was second highest and fentanyl was third. 51 of these 85 participants used methamphetamine daily. When asked how old they were the first time they used methamphetamine, the mean age for the sample was 25.5. From the treatment outcome profile, looking at psychological, physical, and quality of life scores, we found they were largely down the middle, 10.5, 10.8, and 10.1 respectively out of 20. Our Year 1 qualitative findings revealed stigma to be a much discussed issue. A large number of participants and even some of the healthcare service providers from the virtual focus groups reported stigma, judgment, and prejudice. Participants also noted a lack of knowledge and understanding from healthcare providers, specifically understanding the usage of methamphetamine and knowledge of how methamphetamine differs from other substances. Some of these suggested harm reduction strategies included a safe injection site, a safe space, meaning somewhere individuals can use quietly without being overly monitored or supervised, a clean needles and syringe service, including needle exchange, detox and medications to help with cravings and withdrawal. It was also suggested there be more resources at discharge and that if there was a safe injection site, that drop-in hours would be more appropriate than appointments. Healthcare service providers also noted that staff buy-in, resources and hospital layout would be potential barriers. So this study represents a groundbreaking shift towards improving healthcare. There are policy implications, such as the safe consumption of substances in hospitals. As well, we hope this study will change the view on stigma and methamphetamine usage. As well, we hope with the introduction of harm reduction strategies, there will be a reduction and prevention of adverse health outcomes. As well, we anticipate greater flexibility and involvement in patients' care, many patients discharge themselves against medical advice due to cravings and due to needing to use. We hope with these strategies in place that will prevent that and people can get the care they need. Thank you very much for watching and listening to this presentation. If you have any questions, feel free to leave them on the side of the window under Q&A or come and find me on Hoover. My name is John Sorato and feel free to drop me a question. Thanks, and thanks for watching and listening.